Having knee replacement surgery can be daunting. In this video, I'll explain the single most important thing you should be doing after a knee replacement. If you're considering a knee replacement or recently had one, this video is for you. By far, the most common concern after a knee replacement is range of motion. And the most common factor affecting that is pain. To improve your range of motion, you need to move and stretch. But pain and stretching immediately following surgery just don't go well together, do they? I want to let you in on a little secret. Well, more of a simple piece of advice, but secret just sounds a little bit more special. Once you have your surgery, most surgeons and physical therapists will give you a handful of exercises and instruct you to do them 2, 3, 4, even 5 times a day. I'd say 3 times a day is probably the most common. Those exercises will say to bend and hold your knee, straighten and hold your knee, and do 10 or more repetitions. Keep doing these exercises. That isn't what I'm here to talk to you about today. If you're doing your exercises 3 times a day, say 9 a.m., 2 p.m., and 8 p.m., there can be as many as 6 hours of time in between sets, and that's if you're doing them as you should. Before I tell you the secret, I want to explain how your body heals and what's happening to your tissues every minute of the day. When you're actively healing after knee replacement, your tissues get sticky. The physiological reason for this is to attract more platelets in your blood. This helps you to clot and heal more effectively. Your tissues can become pretty stiff when you allow 5 or 6 hours to go by without bending or straightening your knee. So the next time you go to do your exercises, all of your time and painful effort will be spent making up for the ground you lost since your last set of exercises. This often pressures people to do their exercises too aggressively, which actually sets them back. To stop this from happening, simply make sure that at least once an hour, you bring your knee into a full bend, hold for 10 seconds, and a full straighten, hold for 10 seconds. Do 2 or 3 repetitions if you can, but at 1 an hour is the bare minimum. You don't have to torture yourself, but you do need to get a good stretch. The more consistent you are with this hourly stretch, the less aggressive you'll need to be with your daily exercise routine. By the way, if you find this advice helpful, please like this video and subscribe to our channel. This allows us to keep putting out free content for you every week. There are a few exercises you can do to bend and straighten your knee. I want to show you a couple of them. The first one you can do seated. You're gonna bring your heel back underneath you as far as you can. So if your knee's stiff, you might only get to say 80 degrees or so. From there, then you can scoot your body forward and bring that knee over your toe without moving your foot, which will force a little bit more knee flexion. Make sure when you're doing this, you're breathing, because the number one thing I see our patients do is hold their breath, tighten up. Not only is that bad for you, can spike your blood pressure, but it also will make your muscles in your leg tighten without even knowing it. So make sure you breathe on that nice, long, relaxing exhale. That's when you're gonna try and drive that knee forward and increase your flexion. Breathe out, hold it for 5 or 10 seconds, and then back out of it. The next one, which I like even a little bit better if you're laying down or even in your recliner with your leg extended, is to take a strap and wrap it around the bottom of your foot, bend your knee, and then pull that knee into a flexion until you feel a good stretch. Like I said before, breathe out, relax, hold 10 seconds, and then let it go back into straighten. This is a stretch strap, and I can add a link to the description of this video if you want to pick one up for yourself. But you could also just use a sash from your robe or a belt or even an extension cord. Pull it into a nice stretch, hold it 10 seconds, and then let it go. Finally, I'll show you one to work on the straightening of your knee. You're going to use a stool or a coffee table or a chair. Kick your foot up on that. You might have a little bit of bend in that knee because more than likely after knee replacement, it's not going to be going all the way straight. So what you want to do is use your quad muscle right here to force the back of your knee straight. Tighten your thigh, feel that kneecap kind of pull towards your hip, and force the knee down. It might not move a lot, and that's okay. You want to do what you can do. Hold this one for 3 seconds. Do a few of them. It's great if you could feel the stretch in the back of your leg, but depending on when you had your surgery, you also might feel it around the top. That's okay. Think about relaxing every muscle in your body except your quad that you're using to straighten that knee. Keep doing your exercises every 6 hours or so that your PT told you to do, but also make sure to add in this simple advice. Straightening and bending your knee every hour is crucial for promoting better range of motion and a faster recovery. I honestly believe it is the most effective advice anyone could give you, and sadly, most patients are never told this by their doctor or PT. Start right away. I know the pain will try and make you find every excuse not to. Don't fall into that trap. Every hour you miss will just cause more pain and struggle down the road. This video is part of our knee replacement playlist, so make sure to check out some of our other videos like this one. Until next time.